Our patient's name is Karen. She's 72 and she was brought in to see the doctor by her family who is expressing concerns about her increasing memory loss. She's had mental status and neuropsychological assessments, but no brain imaging as of yet and is therefore not diagnosed. Though she has not been diagnosed as of yet, she presents with symptoms consistent with early stage Alzheimer's disease.
Alzheimer's disease is the most common form of dementia. It is a serious brain disorder characterized by memory loss and confusion, and it's caused by the death of brain cells. As you can see in the picture, it's a progressive neurogenic disease, so it has no cure, though there are medical management options available to patients with this disease, including compensatory strategies and medications.
There are three stages of dementia. Stage 1 is the mild or early stage and it lasts 2 to 4 years. Cognition symptoms include frequent recent memory loss, coordination problems such as writing or using objects, or difficulty driving. Communication difficulties include repeated questions, difficulty with expressive and receptive language. Effects on the family life include depression of the patient, apathy, or mood swings. In this early stage of Alzheimer's, there are not very many articulation, phonation, and respiratory related symptoms, as the brain cells continue to die in further stages. Karen's family had come to notice Karen's difficulty driving and repeated questions, but did not express concern until they saw Karen's disinterest in family functions or spending time with her grandchildren. Karen had a prominent career pursuing her passion for clothing design and kept herself busy long after retirement making clothes for her grandchildren. Her daughter has said that she has lost all interest in her sewing room, a place she used to have trouble getting her out of, and says that Karen has spent more and more time sleeping on the couch.
A patient in stage 2 Alzheimer's may experience delusions, aggression, changes in mood, loss in ability to read and write, and the patient will need assistance in normal everyday activities. Though patients at this middle stage experience a lot of communication difficulties, these problems have more to do with the cognitive impairment specifically to expressive and receptive language areas. These patients don't show a lot of articulation and phonological impairment. Once they reach stage 3, they will experience complications due to respiratory impairments, but this is not commonly seen in this stage. Karen has not yet reached this stage of Alzheimer's, but her family has already taken into consideration treatment methods and possible assisted living solutions for her future.
Stage 3 Alzheimer's usually lasts 1 to 3 years. Patients will experience difficulty swallowing due to memory loss, severe to total loss of verbal skills, and they need round-the-clock intensive care. Aspiration can lead to pneumonia, which can affect the family and that they will need help with all daily activities. Brain loses the ability for basic biological functions and is unresponsive to all stimuli. Complications can arise due to aspiration as a result of the patient's inability to swallow properly. Complications can also include choking or pneumonia.
The average costs for long-term care that the family of an Alzheimer's patient may have to consider consist of about $80,000 per year for semi-private nursing home, $91,000 for private nursing home, $20 per hour for in-home health care for this. So this will happen depending on which stage they are. This will happen at varying times during the day. And adult day services usually cost around $59 per day, which would total to about $20,000, a little over $20,000 per year.
Though having an MRI is cheaper and more common, its specificity is much lower than the PET scan. The PET scan gives information not only to aid in diagnosis with higher accuracy, but also on the predicted progression of the disease in each individual patient. This will help us, the clinicians, to create a more comprehensive treatment plan that is tailored to Karen. Alzheimer's is a progressive disease, so we know that ultimately Karen will need to be in assisted living. This treatment plan will include compensatory strategies to keep Karen independent for as long as possible and reduce the amount of time she would need to spend in expensive nursing homes or private health care. Spending $4,800 at most can save almost $100,000 per year that these strategies would keep her self-sufficient.
Thank you for your time.